I'm Rob Ferguson. I'm a plastic and reconstructive surgeon with a subspecialty in reconstruction of cancer, trauma, and complicated wounds. I practice in Salt Lake City and I work with a lot of different specialties. One of the specialties I work with is podiatry. In Salt Lake City we have a large population of Tongan patients, and among the Tongan patients are quite a few diabetics. The diabetics were more prone to develop these foot wounds and infections. And in taking care of some of the patients, they would make comments such as, "Wow, my uncle had this happen to them and they had to amputate his whole leg." Or, "Could you ever come to my country and see what you could do there?" So I flew to Tonga, not knowing anybody yet, and happened to get to know some of the surgeons here at Viola Hospital and began to observe what they're doing. So on that initial trip, I went to the wound clinic, and in seeing all these patients coming in with high blood sugar levels and bad wounds on their feet and ulcers on their feet, I realized, well, why don't we then get to the diabetic clinic before they get to the wound clinic? So we developed a program that would address all points of entry into the healthcare system, from regular public education, education in the schools, public service announcements, screening, to those who are actually diagnosed with diabetes and their treatment and care in the diabetic clinic, those who have some complications such as wounds on their feet, so we're in the wound clinic and the foot clinic, and those that have gotten bad enough to get to surgery, we're working with the surgeons. We're teaching the nurses how to take care of the dressings. What are some techniques that might be a bit better to address the wounds in the feet so that we can salvage the feet, or at least make the amputation in a way that's a bit more functional. Particularly try to prevent this revolving door phenomenon where the same patients continue to come back.